Calling here to talk to you about frozen shoulder syndrome, or adhesive capsulitis it's sometimes called. It's a difficult one to diagnose and kind of figure out. It's also very difficult to treat. And what I'd like to do is give you some exercises and some stretches to start to treat it on your own so that you have some control over this process of healing. So there are a couple things you need to know about this. One is that the shoulder joint is one of the most complicated joints in the body, and the main reason for that is that it's not a ball and socket, meaning it's not the end of a bone fitting into a nice neat little joint or having some sort of a hinge to it. Literally, the bone of the upper arm sits under a shelf of bone like this, and the alignment of the shoulder and the function of the shoulder is completely dependent on all the muscles around here working in harmony with each other, and that means no area being too tight or too weak, or overly tight and yanking it into some sort of position that no longer allows it to sit the way it needs to. So inflammation of the shoulder joint is adhesive capsulitis. So a lot of times this can be caused by some sort of postural distortion, repetitive stress, injury, like doing a lot of computer work, mousing a lot, holding a phone on your shoulder as you're talking, this sort of thing. Anything that's stretched to change your posture and change the positioning of this bone underneath that shelf of the acromion that comes out here. So what I want to do is give you a little bit to work with so that you can start to reverse this process yourself. So the inflammation of the joint can be brought down by stretching out the correct muscles and strengthening the correct muscles. So that's what we're going to go into. One of the most common compensation patterns that people develop when they're in chronic pain, especially shoulder pain, is that they will tend to roll their shoulder forward and lift their shoulder upward. And this is an effort by most people to try and avoid moving your arm into a range that creates more pain, or that elicits the pain. So by doing this, it's almost like a wounded animal trying to protect itself. The problem with this is that your body will adapt to whatever position you hold the majority of the time. So if you put yourself in a position like this, and you've got muscles that run through here, through the upper chest, they will start to adapt to that new length, meaning you're putting it into a shortened position, they're going to shorten more. You're teaching your shoulder joint not to move around and not to get a lot of oxygen and blood flow in there. And so what's going to happen is you're going to get more and more waste product buildup, more inflammation over time. So if you've been really avoiding moving through certain ranges of motion, remember this is not a black and white process, meaning it doesn't insinuate that you either have full range of motion or you have no range of motion. What we want to do is gently start exploring moving the elbow a little bit out from the side. How far can you go until you get a little bit of sensation in the shoulder that it's tight but it's not quite painful? Or maybe it's just going from your elbow being by your side to just an inch out. Even that's progress because we're starting to encourage the joint to move. So one of the first things we're going to do is we're going to stretch out these muscles that run from the neck to the top of the shoulder blade. And what I'm going to have you do, I'm going to pretend like it's my right shoulder that has the frozen shoulder. I'm going to have you reach under your chair here, and you're just going to hook with your fingers underneath the chair. And this is going to be your anchor. Because what we want to do is we want to keep this whole part of the shoulder nice and solid and anchored in so that it's not going to rise up when we go to stretch out the neck here. So the first exercise I'm going to have you do is you're just going to drop your head to the side. And you notice I'm dropping my body a little to the side, so I'm really using this hand as an anchor quite a bit. And just gently leaning to the side is enough. You'll start to feel a pull right through here. And you may get a little bit of tingling in your hand, that's fine, it'll go away once you stop this stretch. So this is the basic stretch for this muscle called the trapezius, one of the two muscles that lifts your shoulder blade up, and one of the two muscles that most likely is shortened. What you can do is you can hang out in this position and just gently breathe into wherever it feels tight, imagining that as you breathe out, those muscles are opening and lengthening. And as you do that, see if you can't drop a little bit more, either dropping your ear toward your shoulder or dropping your whole body to the side, or any kind of combination of those. And you're going to hang out here for a good 30 seconds. That's the first exercise, or the first stretch. The second stretch is for the other muscle that lifts your shoulder blade up, called the levator scapula. A lot of times people get pain right on the top of the shoulder blade here. This becomes a real knotted area. What I'm going to have you do again is grab under the chair, but this time I'm going to have you reach a little bit farther back, so closer to the rear leg of the chair, and you're going to anchor your hand there. From that position, you're going to go from having your head straight forward to turning it at a 45-degree angle. And then from there, you're going to tilt your chin down till it's pointed down toward your opposite thigh here. And from there, you're just going to let your body lean forward. So again, I'm letting my body weight really start to fall forward, using this hand, this arm as an anchor. And what I want you to do is watch out for the tendency to want to lift the shoulder up to try and protect it. Instead, let this slowly stretch. Let this area open. So let the shoulder drop as your body starts to come forward here. Now you can always add your hand on the back of your head to accentuate the stretch a little bit. And again, just like the other one, you're going to hold that for a good 30 seconds. Really breathe into this area that feels tight. With the out breath, see if you can't fall a little more forward at this 45-degree angle with your chest down. So those are the stretches for these two muscles that lift the shoulder blade up. So one of the things we want to do in order to get your shoulder back into the correct position is to release this muscle called the pectoralis minor, which is part of the upper chest, and this rolls your shoulder forward when it gets really tight. Everybody I've seen with frozen shoulder has a tight pectoralis minor. It's one of the key problems. So what I'm going to have you do is just run your fingers right underneath your collarbone, and as you come along toward your shoulder, your fingertips will actually bump right into the bone of the humerus here. So you'll hit that bone. If you come back just a little bit toward the midline of your body, you might find an area in here that's a little bit tender, or feels like it's a little thick. The muscle tissue is a little thick compared to some of these other areas you might be on. So it's right about 3/4 of the way out from your sternum. So as I come right here, I'm just going to take my fingertips and I'm going to gently rub back and forth horizontally. It's called cross fiber friction. And I'm going to use my fingertips. You want to do this with light to moderate pressure. Start light, work your way into more moderate pressure. You don't want to be bruising yourself. The idea is to go back and forth like this for about 30 seconds. And this helps to break up any adhesions that are happening within that muscle, at least at the area that it attaches up underneath the collarbone. So once you've done that, you're going to come right down to your rib cage here. And again, going back and forth horizontally here, you may find a tender spot right about here. So notice this is about halfway out along my collarbone and straight down. So this attaches to the rib cage right in through here. And again, you're going to use that same horizontal cross fiber friction in order to release the other end of that muscle. This will start to help release the whole belly of the muscle. So now the shoulder joint moves a bunch of different ways. So it will be part of your arm coming behind you, coming in front of you, coming out to the side, rotating outward, rotating inward. From this position, rotating outward, rotating inward. So those are all movements that the shoulder does. If we open up or increase one range of motion, any of those motions, it helps all the other ones. So the first one we're going to do is we're going to help you to get your arm back behind you here. For many people, obviously, putting your hand behind your back is the most difficult movement for somebody with frozen shoulder. So what I'm going to have you do is I'm going to have you grab onto a doorknob, like so, and you're just going to step forward until you reach a distance where you start to feel just a little bit of tension in through the shoulder, maybe a little discomfort. A little bit's okay. Make sure that you're not rotated back like this toward the door. Make sure that your body's squared with both shoulders and your head going away from the door. And from this position, what I'm going to have you do is I'm going to have you pull on the doorknob as if you're trying to pull it toward your butt, as if you're thinking about stretching it toward you. What this does is it activates some of these muscles that have been really tight, and what we're doing is we're going to contract and relax them, and each time it relaxes, it helps to reset the length of the muscle to its natural state instead of this shortened state. So I'm going to pull it toward my butt, light pressure as I do this, hold it for 10 seconds, and then let that release. Once I let that release, I'm going to take a little step forward, and notice it's a real small step. So I want you to slowly challenge yourself with this. So you're going to do this 3 times. Again, pulling the handle toward my butt, holding that again for 10 seconds, and I let that relax. When you relax, you're really letting the shoulder go as much as you can. So you're going to do that 3 times. You may not be able to take a little step forward with each of those, but it's important to do it 3 times so that we start to get a little more length. And this will also help to open up this upper chest as well. Once we've opened up these muscles of the upper chest and the muscles that lift your shoulder blade up, now your shoulders should be able to drop a little more down and a little more back. So what I'm going to have you do is let your arm hang by your side. And on the affected side, on the frozen shoulder side, what I'm going to have you do is lift your shoulder up, rotate it back and down. So you're going to do little circles with it. You're going to do 20 circles one way. So going backwards to begin with. And after you've done 20, now you're going to lift up and go forward. So notice I have to pull back a little to then lift up and go forward. Now you may not have this much mobility, that's okay. Anything you can do is going to be helpful. What this does is it starts to lubricate the joint. We're trying to get more blood and oxygen into this joint, because the more blood and oxygen you get in here, the more it flushes out the waste products that are caused by muscles being bound down and really tight. Remember, if a muscle's really bound down and tight, new blood and oxygen can't get into that area very well. The byproduct of muscles being really tight is lactic acid, histamines, other things that actually end up irritating the nerves and creating more pain. So we want to flush this out so that your pain level, your inflammation level can start to drop. Let's move along to another stretch which targets a muscle right in the armpit here called the subscapularis. The subscapularis is another muscle that tends to rotate the shoulder inward. So in order to do this, you need a door frame. Instead of demonstrating on the right side, because I've got this nice wall here to demonstrate, I'm going to show you how you do this, but using the left side. So one thing that's very difficult for people with frozen shoulder is to do what we call external rotation, bring your arm outward this way. So what we want to do in order to increase that range of motion is, what I want you to do is keep your elbow to your side, but I don't want you to pin it down super tightly. That's not the goal here. We want to keep it gently, just touching the side. And then I'm going to have you take your fingers and just put them right along the door frame here. So this doesn't have to be something that's really vigorous in any way, shape, or form, just like so. And notice I'm starting facing the door frame like this so that I can keep my arm by my side and straight forward and in a position that's somewhat comfortable. From this position, what I'm going to do is I'm going to slowly turn my body this way, letting my hands stay here. And I'm going to turn, and I can even move one foot a little bit if that's more helpful. I'm going to turn until I reach a point where I feel some restriction. Once I get to that, what I'm going to then do is I'm going to take my hand, I'm going to push lightly in toward the wall this way. So I'm going to come here and I'm going to gently push into the wall with my palm. I'm going to hold that for 10 seconds. Just like some of the other stretches, then you let your whole shoulder relax, see if you can let it drop a little bit, see if you can turn a little bit farther. You're going to do this again and yet one more time. So 3 times in order to release this subscapularis.